Glaucoma, that's an old person's disease, right? Ever heard of Hall of Fame baseball player Kirby Puckett? Near the end of his career, while still playing for the Minnesota Twins, he suffered a glaucoma attack. That same day, he went completely blind in his right eye. He never played another professional game again. He was only 36 years old. The type of glaucoma Kirby Puckett got was acute angle closure glaucoma. Now this variety of glaucoma, and there are more than a dozen types, is no joke. It's a real eye emergency, and it can cause blindness in a matter of hours. Most people don't have a clue that they're at risk for it until it's too late. Acute angle closure glaucoma, it can attack anyone at any time. And what a tragedy, because Kirby Puckett's vision loss, or anyone's risk for vision loss due to angle closure glaucoma, is preventable. So what exactly is this condition? How can you spot it? And most importantly, how can you protect your eyes? Let's break it down. By the way, hi, I'm Dr. Mike Vernon, and this channel is all about eyeballs. To understand angle closure glaucoma, you first need to understand what the angle is. Picture this. Your eye has a small reservoir of fluid in the front called the anterior chamber. The fluid inside the anterior chamber is called aqueous humor. Located behind the iris, the ciliary body produces aqueous. From there, aqueous flows toward the pupil, through the pupil, and into the anterior chamber. From there, it drains out where the iris and the cornea meet at the trabecular meshwork. It's labeled TM on the diagram. Yes, I drew the diagram. The space where this drainage happens is called the angle. When the angle's open, fluid drains smoothly, like water going down a kitchen sink. But if the angle closes, the drainage of aqueous stops, like putting a stopper in the sink. The pressure inside the eye builds up rapidly, putting extreme stress on the optic nerve. The stress that high pressure puts on the optic nerve damages it. That's glaucoma. An acute angle closure attack can significantly damage your optic nerve very quickly. You can lose your vision in a matter of hours. It is a true emergency. Here's the scary part. Angle closure glaucoma doesn't give you any warning. It happens suddenly, without notice, and with severe symptoms. You'll have excruciating eye pain, experience a massive frontal headache, have blurry vision, see colored halos around lights, feel nauseated, and you'll probably start vomiting. If this happens, get to an eye doctor or the emergency room immediately. No waiting, no, let's see if this gets better. So who does this happen to? Not everyone. You have to have narrow drainage angles to be at risk. If your angles are wide, they won't close. But if they're narrow, an attack can happen. About 2 to 4% of the world's population has at-risk narrow angles. And about 10 to 15% of at-risk people will experience an angle closure attack if left untreated. The risk factors include age, it's more common in older adults, gender, women are at higher risk, family history, farsightedness, cataracts, and certain medications like antihistamines and antidepressants. Do you want to know if you're at risk? A simple eye exam can tell you. Eye doctors use a slit lamp microscope to check to see if your angles are narrow or not. It takes just a few seconds. What's the best way to prevent an angle closure attack? Annual eye exams. It is that simple. If you have narrow angles, your doctor can offer preventative treatment before an emergency happens. But let's say you don't know you have narrow angles. One day you start experiencing severe eye pain, an intense headache, and a rush of nausea. You dash over to the eye doctor, and she diagnoses you with an acute angle closure attack. There's still time to save your vision, but action must be taken immediately. When an attack happens, the goal is to lower the pressure in the eye as fast as possible. This is done with eye drops, every class of eye drop the doctor has in the office. Oral medication to reduce aqueous production, IV medications if you're at the hospital, and in some cases, a tiny puncture in the cornea can help drain fluid quickly. If you're diagnosed with narrow angles, there is a simple procedure to prevent an attack before it ever happens. It's called a laser peripheral iridotomy, LPI. A laser makes a tiny hole in the iris, and this creates an alternate drainage pathway for your eye's aqueous to follow. It's a quick, in-office procedure that will lower your odds of having an angle closure attack. If you have narrow angles, you should also avoid certain medicines like antihistamines and some antidepressants. Be cautious with prolonged near work in dim lighting and know the warning signs of an angle closure attack and seek help immediately if symptoms occur. All right, friends, you have to find out if you're at risk for angle closure. Just go get that annual eye exam. It is so easy. If you are at risk, take the steps that'll guard you from having an angle closure attack. But if angle closure glaucoma ever sneaks up on you, you'll know what to do. Seek the right help right away. You don't have to lose your vision. If this video has helped you make better sense of glaucoma, please share it with someone who might need this information. Take care of your eyeballs. They are your windows to the world.